This is Chapter 7, Module 2, Spinal Column and Thoracic Cage. The learning objectives of this module are 1. Describe the different components of the spinal column. 2. Identify the differences in structure and function of the various vertebrae. 3. Identify and describe the normal curvatures and the abnormal curvatures of the spinal column. 4. Describe the significance of the atlantoaxial articulation. 5. Describe the different components of the thoracic cage. And 6. Describe the significance of the articulations between the thoracic vertebrae and the ribs and between the ribs and the sternum. The vertebral column is another name for the spine. The vertebral column protects the spinal cord and supports the head. It is a flexible column that extends from the neck to the tailbone and is made up of a series of bones called the vertebrae. 26 bones make up the vertebral column. 24 are vertebrae, plus 1 sacrum and 1 coccyx. These 26 bones are grouped together in vertebral regions. These regions are the cervical, thoracic, lumbar, sacral, and coccygeal regions. The cervical region is in the neck and contains 7 vertebrae. The thoracic region is in the upper and mid-back and contains 12 vertebrae. The lumbar region is in the low back and contains 5 vertebrae. Both the sacral and coccygeal contain only 1 bone each, the sacrum and the coccyx, respectively. Each vertebrae articulates with the bone above it and the bone below it, except for the coccyx, which only articulates with the bone above, the sacrum. The vertebral column is formed by these articulations, creating one long flexible column. When viewing the vertebral column from an anterior view, the spine looks straight with no curvatures. However, when viewing the vertebral column from the lateral view, 4 distinct curves can be seen: the cervical curve, the thoracic curve, the lumbar curve, and the sacral curve. The thoracic and sacral curves are called primary curves. The primary curves are present during fetal development. They can also be called accommodation curves because it is believed the reason they form is to accommodate internal organs that need room as they develop. The lumbar and cervical curves are called secondary curves because they appear after birth. They can also be called compensation curves because it is believed that they develop as the baby begins to strengthen the spinal muscles. As the baby begins to lift his head off the bed, he will develop the cervical curve, and as he begins to lift up as he extends his arms underneath him, he will begin to develop his lumbar curve. The cervical and lumbar curves will continue to develop as he begins to stand and walk and must balance the weight of his head and his body to keep his balance. An abnormal exaggeration of the thoracic curve is called a kyphosis. A kyphosis can develop with osteoporosis or with other degenerative conditions. An abnormal exaggeration of the lumbar spine is called a lordosis. A lordosis can develop during a weight gain such as pregnancy or obesity. An abnormal lateral curvature of the spine can be seen from a posterior view and is called scoliosis. The spine appears as an S shape, causing the shoulders, hips, and scapula to be unlevel. Scoliosis can occur due to a degenerative process, but more often the cause is unknown and is called idiopathic. Idiopathic scoliosis usually occurs in adolescent girls. The vertebrae in the cervical, thoracic, and lumbar regions have basically the same anatomy with some distinct differences. The cervical vertebrae are the smallest of the vertebrae. The thoracic vertebrae are a little larger, and the lumbar vertebrae are the most massive of the vertebrae. Whether discussing the individual vertebrae in the cervical, thoracic, or lumbar region, the typical vertebrae will have several of the same structures. The vertebral body is the most anterior part and the largest part of the vertebrae. The vertebral body will rest upon an intervertebral disc. The intervertebral discs are pads of fibrocartilage. They separate the vertebral bodies and they absorb shocks to the spine due to impact. The vertebral bodies bear the weight of the spine, so the posterior structures of the vertebrae do not. The structures posterior to the vertebral body form an arch, called the vertebral arch, creating a wide circular opening called the vertebral foramen. When all the vertebrae are stacked on top of each other and aligned in one column, the vertebral foramen forms a long tunnel from the skull to the tailbone, where the spinal cord will descend from the brain. This long tunnel is called the vertebral canal. The structures creating the vertebral arch are called the lamina and the pedicles. The pedicles are short, broad extensions from the vertebral body. The lamina extend posterior from the pedicles to fuse together and form the spinous process. The lamina are longer and thinner than the pedicles. The spinous processes extend posteriorly and is a structure you can feel and oftentimes see through your skin. At the junction of the pedicle and the lamina, a process called the transverse process extends laterally on each side. Also at the junction of the pedicle and the lamina are projections called the articular processes. The superior articular process extends superiorly and the inferior articular process extends inferiorly. The superior articular process of one vertebrae will articulate with the inferior process of the vertebrae above. At this point, where these two processes articulate, the processes have a smooth surface to facilitate easier movement between the two structures. This smooth surface is called the facet, so the superior articular process contains a superior articular facet, and the inferior articular process contains an inferior articular facet. It is where the facets touch or meet or articulate that form the intervertebral joint. When the vertebrae are aligned in a column, a space is created between the pedicles of adjacent vertebrae. This space is called the intervertebral foramen. Nerves extend from the spinal cord that descended through the vertebral canal and then through the intervertebral foramen. These nerves are called spinal nerves. In each of the vertebral regions, the vertebrae are numbered from the top to the bottom, or from the superior to the inferior, and an abbreviation is also given for each region. The abbreviation for the cervical vertebrae is C, the thoracic is T, and the lumbar is L, the first letter of the words. The first cervical vertebrae is numbered C1. C1 articulates with the skull. The next vertebrae is C2, then C3, then C4, all the way to C7. The first thoracic vertebrae is T1, and since there are 12 thoracic vertebrae, the last thoracic vertebrae is T12. The first lumbar vertebrae is L1, and the last lumbar vertebrae is L5. C7 articulates with T1. T12 articulates with L1, and L5 articulates with the sacrum. The sacrum and coccyx are also abbreviated. The sacrum is abbreviated as S, and the coccyx as CO. While the cervical, thoracic, and lumbar vertebrae have all of the typical structures discussed, each region of the spine has unique characteristics giving the region specific functions. The cervical vertebrae have very small vertebral bodies, since this region only needs to support the head and not the entire spine. The vertebral foramen in the cervical region is very large, the largest of all the regions. This is because the spinal cord is largest in this region where it initially descends from the brain. The vertebral body of the cervical vertebrae have a concave superior surface, and the vertebrae itself tends to slope downward from posterior to anterior. The first cervical vertebrae, or C1, is also called the atlas. The atlas does not have a spinous process. Instead, the lamina of the atlas fuse together to form the posterior arch. All the other cervical vertebrae have short spinous processes. The tip of each of these spinous processes is notched or forked, which we term as a bifid spinous process. There is an opening in the transverse processes of the cervical vertebrae called the transverse foramen. The transverse foramen is found only in the cervical vertebrae. The vertebral arteries travel superiorly through the transverse foramen and then through the large foramen magnum of the skull to supply blood to the brain, and the vertebral veins descend through the transverse foramen to drain blood from the brain region. The first cervical vertebrae, C1, has other distinct characteristics. The skull sits upon the atlas. The skull has two projections called the occipital condyles, and these condyles rest upon the two smooth surface articular facets of the atlas. The superior articular facets of the atlas are larger than the facets of other vertebrae. Also, the concave facets face superiorly, and the superior articular process that contains the facet is very short. As was previously mentioned, the atlas doesn't have a spinous process, and it also doesn't have a vertebral body. In place of the vertebral body is the anterior arch. The anterior arch and the posterior arch of the atlas form the large round vertebral foramina. The second cervical vertebrae, or C2, is also given a special name. It is called the axis. The axis supports the atlas. It has a heavy spinous process where muscles of the head and neck attach. It does not have a vertebral body. Instead of a vertebral body, it has a superior projection called the dens. The dens projection articulates with the anterior arch of the atlas. When C2 pivots, causing the head to move back and forth in a motion saying no, the dens rotates on the anterior arch of C1. There is a ligament called the transverse ligament that keeps the dens close to the anterior arch, within 4 millimeters. If the transverse ligament is damaged through whiplash or is compromised due to conditions such as Down syndrome and cerebral palsy, there is an increased possibility of spinal cord damage due to the protrusion of an unstable dens into the vertebral canal. The last cervical vertebrae, or C7, is called the vertebra prominens. Its spinous process is the largest projection you can feel at the base of your neck. C7 looks a lot like the thoracic vertebrae, except that it still has the transverse foramen that only the cervicals have. There are 12 thoracic vertebrae numbered from T1 to T12. The thoracic vertebrae have heart-shaped bodies that are much larger than the cervical vertebrae. However, the vertebral foramen of the thoracic vertebrae are smaller than the vertebral foramen of the cervicals. The thoracic vertebrae have long, slender spinous processes. On the dorsolateral surface of the vertebral body are small indentations called the costal facets that articulate with the heads of the ribs. Each body has 2 superior costal facets and 2 inferior costal facets. In addition, the thick transverse processes contain a facet for articulation with the rib. This facet is called the transverse costal facet. Ribs articulate with the costal facets on the vertebral body and the transverse facet on the transverse process before the ribs wrap around to the anterior thoracic region and articulate with the sternum, or breastbone. T10 through T12 start to transition to lumbar vertebrae and begin exhibiting the characteristics of a lumbar vertebrae. There are 5 lumbar vertebrae numbered from L1 through L5. The lumbar vertebrae are the largest, most massive of all the vertebrae. They have oval-shaped bodies that are thicker than the thoracic vertebral bodies. Since no ribs articulate with the lumbar vertebrae, there are no costal or transverse costal facets. The vertebral foramen formed by the pedicles and lamina are triangular shaped. The superior articular processes of the lumbar vertebrae face up and in, whereas the inferior articular processes face down and out. The transverse processes of the lumbar vertebrae are slender and project dorsolaterally rather than straight lateral. The spinous processes are short, heavy, and broad and provide an attachment for the muscles of the lower back. The sacrum is the vertebral region below the lumbar region. The sacrum is a curved, triangular-shaped bone that protects the reproductive, urinary, and digestive organs. The sacrum is attached to the pelvic girdle. Attached to the sacrum are broad muscles that move the thigh. In an adult, the sacrum consists of 5 fused sacral vertebrae. These 5 vertebrae fuse sometime between puberty and 25 to 30 years of age. 4 sacral foramina are formed during this fusion. The vertebral canal continues into the sacrum, but is now called the sacral canal. At the superior surface of the sacrum is a broad area called the sacral base. The sacrum narrows inferiorly to the apex of the sacrum that articulates with the coccyx. The coccyx is the lowest region of the vertebral regions. It consists of 3 to 5 fused coccygeal vertebrae. The coccyx is an area for attachment of ligaments and a muscle of the anus. The thoracic cage is the skeleton of the chest. It consists of the thoracic vertebrae, the ribs, and the sternum or breastbone. The thoracic cage helps protect the organs of the thoracic cavity that includes the heart, lungs, and thymus gland. Muscles of respiration, as well as muscles of the vertebral column, pectoral girdle, and upper limbs attach to the thoracic cage. There are 12 pairs of long, curved ribs that extend from the thoracic vertebrae around to the anterior. The first rib, or rib 1, is the most superior rib and articulates with the first and second thoracic vertebrae. Ribs 1 through 7 are termed true ribs because they are connected to the sternum by costal cartilages. Ribs 8 through 12 are called false ribs because they don't attach directly to the sternum. Instead, the cartilage from ribs 8 through 10 merge with the cartilage from rib 7 before reaching the sternum. And ribs 11 and 12 have no connection with the sternum at all, and so can also be called floating ribs in addition to false ribs. Each rib has a head that contacts the costal facet on the thoracic body, a tubercle that contacts the transverse costal facet of the thoracic vertebrae, and a body that circles anteriorly to the sternum. The sternum is a flat bone in the midline of the thoracic wall, otherwise known as the breastbone. The sternum has 3 parts: the manubrium, the sternal body, and the xiphoid process. The manubrium is the most superior portion of the sternum. It has a broad triangular shape. At the superior and lateral sides, the sternum articulates with the clavicles, or collarbones. On the superior surface of the manubrium is the jugular notch, that is a shallow indentation between where the clavicles articulate with the sternum. The sternal body is attached to the manubrium inferiorly. The sternal body has a tongue shape. The costal cartilages of ribs 2 through 7 attach directly to the sternal body. The xiphoid process is the small part of the sternum. It attaches inferiorly to the sternal body. Attached to the xiphoid process are the diaphragm and rectus abdominis muscles. This ends Chapter 7, Module 2, the spinal column and thoracic cage.